Thank you, Marcy. Good morning. My name is Andrew Mowen. I'm with the Pennsylvania State University. I'm in the Department of Recreation, Park, and Tourism Management. And today I'd like to make a few remarks concerning the importance of park and recreation services for the health and the well-being of our Commonwealth citizens. And I'd also like to talk a little bit about some of the national research and state-level research that's been done on this topic. The environmental and educational benefits of our park infrastructure have been well documented for some time. And indeed, since the early part of the 20th century, Pennsylvania has been a leader in establishing public park services for its citizens. More recently, however, a number of international, federal, state, and local organizations have acknowledged the role that park facilities and services play in providing low-cost health and physical activity benefits for a broad cross-section of the population. In fact, a great deal of science is now emerging concerning the role of parks in conferring both physical and mental health outcomes. However, my time today is brief, so let me share a few key highlights from national and statewide research on this topic. And I promise I'll try to keep it interesting here. Let me first begin by citing some national studies, and then from there we'll talk about the Commonwealth. Park use is widespread across the United States. Nationwide studies have found that a majority of Americans visit their local parks, and 9 out of 10 Americans have participated in at least one type of outdoor recreation activity annually. In terms of access and proximity, we know that when parks are in closer proximity to populations, they're used more frequently. But there's now empirical evidence that suggests that close proximity to parks is also associated with higher levels of daily physical activity, particularly when parks are within walking distance. For example, a national study of U.S. adults found that those who perceive parks to be accessible to them were twice as likely to meet national guidelines for physical activity. Park proximity is important for youth as well. A study in Atlanta, Georgia found that youth with one or more parks within close proximity to their homes were also 2 to 3 times more likely to engage in regular walking than youth without any nearby parks. In terms of park capacity, it's not just about proximity, it's also about what we provide to our citizens. In addition to providing close-to-home access, it's also important to provide a significant and sufficient number of parks and park area or acreage in order to achieve these health outcomes. A study of park and recreation capacity in West Virginia found that counties with more park and recreation facilities, and thus more acreage devoted to recreation, had a lower proportion of their population reporting insufficient physical activity levels. So clearly there's a connection there between capacity and physical activity. Well, we know that the nation's obesity epidemic has really spawned these studies concerning physical activity, but parks also confer a number of mental health and stress reduction benefits. Well, what do we know about Pennsylvania? Well, there's evidence that suggests that Pennsylvanians also realize significant health benefits from the opportunities provided by state and local governments, as well as state-level nonprofit organizations. For example, in 2008, a survey of state park visitors found that the reasons for visiting state parks and the benefits that were realized from their visitors were primarily stress reduction as well as connecting with the outdoors. So there's some mental health benefits going on there. We also found that a majority of state park visitors engaged in some form of moderate or vigorous physical activity, and almost half of all state park visitors reported that they were more physically active during their state park visit than in their day-to-day lives. Now, these research results represent only a fraction of what we're learning concerning the role of park facilities and park services as part of our nation's and indeed our Commonwealth's preventive health system. And as I mentioned in my opening remarks, Pennsylvania has been a leader in stewarding these environmental, educational, and health-related benefits over the last 100 years. However, park facilities and services rely on adequate and sustainable funding support to ensure that park-related benefits can be realized at a low cost for a wide cross-section of our Commonwealth population. It is my personal desire to see these valuable services supported and financed, not only at the federal level, which is being done, but also at the Commonwealth level, working in cooperation with local governments and nonprofit organizations. Thank you for allowing me the opportunity to share my thoughts on the value of park and recreation services for the health of Pennsylvania.